Hi, I'm Dr. Nathan Nachlas, and welcome to our practice. This has been our 30th year in practice in Boca Raton, Florida. It is amazing the progress that I have witnessed in the field of nose and sinus surgery and nose and sinus procedures over the past 3 decades. When I was at Johns Hopkins, a very important thing happened in the field, and that is when minimally invasive sinus surgery started. It started there in 1985 when one of the professors at Hopkins brought over from Austria a way to cure people from sinus disease. And this was a radical departure from what had always been done for sinus disease in the past, which was fairly big surgery. So in 1985, the technique that was brought over to Hopkins was using a telescope to look up into the sinus and very gently open the opening of the sinus to allow the rest of the sinus to become normal again. And that was known as endoscopic sinus surgery or minimally invasive sinus surgery. Since 1985, there has been gradual evolution and now possibly revolution in the treatment of sinus disease. In the early 1990s, we became the first center in an outpatient environment to allow the procedure to be done off of the computer. So following that period of time, and it has now been approximately 25 years, sinus surgery went from a purely visual type procedure to one that was done with computer guidance. And what that did is it made it more precise and extremely safe. The next major advance in our approach to the nose and sinuses was with the advent of balloon sinuplasty. Again, we were at the forefront of that and really enjoyed when this technology came out. It was technology that had previously been used to open up blocked cardiac vessels, and now we were able to use it in the sinuses. In our office in 2014, we performed the first computer-assisted balloon sinuplasty in the United States. In this procedure, a small balloon that is guided by the computer is inserted into the blocked sinus. And the blocked sinus is what it causes patients to have sinus infections, headaches, congestion, blocked noses, pressure around the eyes, drainage from their sinuses. All of these symptoms are related to chronic sinusitis. So we now had a procedure in the office that is guided by the computer where we can take the balloon, put it in the precise area that we want to open up to relieve the blockage in the sinus, and then we inflate the balloon, deflate the balloon, and then take it out. The procedure for each sinus takes approximately 1 minute, and then we locate all of the affected sinuses and dilate each infected sinus, and then the procedure is over. It has been a great, really a revolution in how we treat it, because now most sinus procedures as standalone procedures are done in the office rather than in the hospital or under anesthesia. What this means for the patient is much quicker recovery, much minimal downtime, and virtually no swelling or bruising after the procedure. So it's very well tolerated by the patient. Current investigations are with even newer technology for other issues we see in the nose and sinuses. Currently, we're conducting a trial of the Spirox Latera. The Spirox Latera is a device that we use as an implant in the wall of the nose. Some patients, when they breathe in, and they notice this especially during exercise or heavy activity, don't get enough air through their nose. These are the patients who will often respond to wearing a Breathe Right strip. You often can see football games, and on the field, the players have Breathe Right strips all over the bottom of their nose. And this is because when you increase nasal respiration and the inspiratory pressure inside the nose increases, the sidewalls of the nose can collapse. So the Spirox Latera does something very similar to what a Breathe Right strip does, is it holds open the nose while you're breathing. And this is especially important when you have either weak lateral sidewalls or you constantly tax the nose by heavy exercise. So we've had really good results with that. When somebody comes to the Nose and Sinus Institute of Boca Raton, what we do is we individualize treatment for each patient. The treatment virtually always will start with conservative medical management, whether that is antibiotics, whether that is allergy nose sprays, whether that is decongestants. Often we'll get allergy tests on the patients to see what it is that's causing the problem. When medical management fails, and many of our patients come already having failed medical management, then we individualize the approach to how do we fix the problem. We look at different areas. The sinuses we usually treat using the balloon sinuplasty technique. Sometimes we need to repair a deviated septum. Sometimes we need to reinforce the sidewalls of the nose, and that's where the spirox latera comes in. And sometimes we have to shrink the allergy swelling out of the tissue, and that is known as a submucous resection of the inferior turbinates. But any of those procedures or all of those procedures can be done fairly quickly, comfortably, in the office with minimal recovery.